Hey everyone, ready for a deep dive into something that should really matter to all of us. We're talking myopia and glaucoma risk.
Oh,
Specifically, we're looking at a 2022 paper from the American Journal of Ophthalmology, a dose-response meta-analysis.
okay.
This one, I think it has some serious implications for how we manage our patients, especially those with myopia.
Right. This study, it really highlights how much the degree of myopia a person has can impact their chances of developing open-angle glaucoma.
OAG.
Yeah, OAG.
So before we get too far into it, can you just quickly remind everyone what we mean by dose response?
Sure.
Just want to make sure we're all on the same page here.
Basically, it just means that as the dose of something, anything goes up, the response to it also changes. In this case, the dose is how much myopia a person has.
The degree.
Right, the degree.
Yeah,
And the response is their risk of developing OAG. So worse myopia, higher glaucoma risk.
makes sense. Now, this meta-analysis, it wasn't just a small study, was it?
Oh, no, not at all. This was a massive undertaking.
How many people did they look at?
They pulled data from 24 different population-based studies, over 514,000 individuals,
Wow.
and from 11 different countries, too, so a really diverse group. Pretty impressive scope.
Yeah, definitely gives the findings more weight.
hmm
So what did they find? Was there a clear link between myopia and glaucoma?
Pretty clear, yeah. They found that people with myopia, any amount, they have about double the risk of developing OAG compared to people without myopia.
Double. Wow.
But the thing is, it's not the same across all levels of myopia. That's where the dose response part really comes in.
So it's not just a yes or no answer. There's more nuance to it.
Exactly. It really depends on how much myopia we're talking about.
Yeah, and I've definitely noticed that in my own practice, more glaucoma cases seem to pop up in those with high myopia.
Oh, for sure. And this study actually puts some numbers to that. They found that people with what they call high myopia, so worse than -6 diopters, have more than 4 times the risk of developing OAG compared to those without myopia.
4 times. That's a huge jump.
It is.
Really drives home the point that we can't just treat myopia like a simple vision problem. Got to remember it's a risk factor for other serious eye conditions, like glaucoma.
Absolutely. Got to think long term, you know? It's not just about seeing clearly now, it's about protecting their vision for years to come.
So can you talk a bit about why this connection exists? What's going on in the eye that makes people with higher myopia more susceptible to glaucoma?
Well, there are a couple of main theories. One is what we call the mechanical theory.
Yeah.
This one focuses on how the anatomy of a myopic eye actually changes.
Right, they tend to be longer, right, like physically longer than a non-myopic eye.
Exactly. That extra length, it puts a lot of strain on the structures inside the eye, especially the optic nerve head.
Which is kind of bad news when it comes to glaucoma, right?
Yeah, because glaucoma specifically damages the optic nerve, which can lead to vision loss over time. So with myopia, that optic nerve is already under more stress because of the shape of the eye.
It's like if you stretch a rope really tight, it's much easier to snap it.
Exactly. Great analogy. And then the other theory, it looks at blood flow.
Ocular perfusion.
Yeah, that's the fancy term. There's some research that suggests myopia could lead to, well, less blood getting to the eye, especially that optic nerve.
So it's not just the shape, it's maybe also the blood supply that's causing problems.
That's what some researchers think.
Double trouble.
Yeah, you could say that. And when you combine that reduced blood flow with the structural weakness of the optic nerve head, it's kind of a recipe for glaucomatous damage.
Yikes. So we've got these two theories possibly working together, explaining why myopia, especially the high myopia, is such a risk factor for glaucoma.
Yeah.
And the study, it broke down the risk by different levels of myopia, right?
Yeah, they did. Even low myopia, so up to longest or 3 diopters, carries an increased risk, about 1.5 times higher than no myopia. Moderate myopia between -3 and 6 diopters is about 1.7 times the risk.
And then that big jump with high myopia, anything worse than -6 diopters.
Right, over 4 times the risk. So it's really something we can't afford to ignore.
So just to be clear, how did they actually go about doing this meta-analysis?
Well, it's like a study of studies. They looked at a ton of research on myopia and glaucoma, specifically those big population-based studies.
Right.
They gathered all that data together and analyzed it as one giant data set.
So it's like taking puzzle pieces from different boxes and putting them together to see the whole picture.
Perfect analogy. And by doing that, they got a much clearer understanding of the relationship between myopia and glaucoma than any single study could give us.
Right, the power of meta-analysis. Now, did they look at anything else besides just the degree of myopia?
Yeah, they also looked at axial length.
which is...
It's a measurement of how long the eye is, front to back.
Ah, okay.
And guess what they found?
I'm all ears. What did they find?
For every millimeter increase in axial length, the risk of OAG went up by almost 40%.
Whoa, that's a lot.
It is, right? So the longer the eye, the greater the risk, even if their myopia isn't that bad in terms of diopters.
So it's like two separate risk factors, the degree of myopia and how long the eye is.
Exactly.
Gotta think about both.
Absolutely.
Really interesting stuff. I'm already thinking about how this changes things in my practice. But before we get into that, were there any limitations to the study that we should be aware of?
Yeah, there are always limitations with research. One thing they mentioned was that how open-angle glaucoma was diagnosed wasn't exactly the same across all the studies they included.
It makes sense.
Yeah, there's not always perfect consistency in how we diagnose it.
Right. It can be a tricky one. Anything else?
They also pointed out that some of the studies handled certain variables a little differently,
Like what?
like adjusting for things like age or ethnicity. Some did it one way, others another, and that could potentially skew the results a bit.
Introduce some bias.
Right. But they did try their best to take that into account.
Seems like they were very transparent about the limitations, which is always good to see. Okay, so it sounds like this meta-analysis was really thorough. It gave us a ton of good information about myopia and glaucoma risk, but like with any good research, it also raised a lot of new questions.
For sure. And they actually called for more research specifically on how myopia, age, ethnicity, and glaucoma all interact. It's clear we've still got a lot to learn.
It's a never-ending journey, the pursuit of knowledge.
It really is.
Well, this deep dive has definitely been eye-opening, no pun intended.
Oh, I see what you did there.
So now I'm really curious to hear your thoughts on what this means for us in the clinic. How do we take this research and actually use it to help our patients?
Yeah, that's the million-dollar question, isn't it? How do we translate this into practical action?
Exactly. For example, how should this change how we screen and monitor our patients with myopia?
Well, first off, it really reinforces how important those comprehensive eye exams are.
Including dilation.
Oh, absolutely. Got to get a good look at that optic nerve. Can't just rely on a refraction, especially for patients with moderate to high myopia.
Those are the ones we really got to keep an eye on, so to speak.
Exactly. We might even want to see them more often, maybe start visual field testing earlier than usual, and think about using things like OCT to really keep tabs on that optic nerve.
It's all about assessing their individual risk and tailoring our approach.
Personalized medicine at its finest.
And of course, patient education is crucial.
Oh, absolutely. We got to make sure they understand what's going on, what their risk is, and how important those follow-up appointments are.
No more beating around the bush.
Right. We got to be upfront, explain the potential consequences of unchecked myopia, and emphasize how important early detection and treatment are.
It's not just about giving them clear vision today, it's about protecting their sight for the future.
Couldn't agree more.
All right, so we've got screening, monitoring, patient education, all super important. But what about treatments? Are there any specific glaucoma treatments that might be more effective or better suited for patients with myopia?
That's a great question. It really depends on the individual patient and how advanced their glaucoma is.
Of course, of course. But are there any general trends?
Well, some research suggests that certain medications, like prostaglandin analogs, might be particularly helpful for those with longer axial lengths.
Interesting. Why would that be?
Seems like they work better at lowering eye pressure in those longer eyes, which is what you see with myopia.
Makes sense. So that's something to keep in mind when we're making treatment decisions for these patients.
Definitely. But again, it's all about individualizing care.
Now, this study focused on open-angle glaucoma, which is the most common type. But what about other types of glaucoma? Does myopia increase their risk too?
That's a good question. There is some evidence suggesting it might increase the risk of other types, like angle closure glaucoma, but we need more research to be sure.
Always more research.
Always.
It seems like the more we learn about myopia, the more complex it becomes.
It really does.
This meta-analysis, it's given us a much clearer picture of how myopia and glaucoma are connected, but it's also opened up a whole new world of questions.
It's like peering through a new lens, literally.
Huh. Well, I think this deep dive has given us all a lot to think about, and I'm sure our listeners are feeling the same way.
I hope so.
So let's move on to the final part of our deep dive. We'll recap the key takeaways from this research and talk about how we can best apply these insights in our everyday practice. Okay, so we've talked about the study, what they found, some of the limitations. Now, I'm really interested in how we can actually use this information in our practices.
Right, got to make it practical.
Exactly. Like, how should these findings change the way we approach screening and monitoring patients with myopia?
Well, I think it definitely highlights the importance of those comprehensive eye exams. Got to do them.
For everyone with myopia.
Pretty much, yeah. Especially that dilated exam. We really need to get a good look at that optic nerve.
So no skipping the dilation, even if their myopia seems mild.
Nope, can't just rely on the refraction numbers. We need to see what's going on in there. And for those with, moderate to high myopia, especially if they've got a long axial length, well, we might need to be even more proactive.
What do you mean?
Like seeing them more frequently, maybe? Starting visual field testing earlier than we normally would.
Oh.
Even considering some of those fancy imaging techniques like OCT, anything to get a really good look at that optic nerve and track any changes.
So it's all about individualizing their care
Mm.
based on their level of risk.
Exactly. Personalized medicine, that's the way to go. And that goes for patient education, too. We got to make sure our patients understand what's going on.
What their risk is, why it matters.
Right. And why those follow-up appointments aren't just a suggestion, they're really important.
No more beating around the bush. We got to be upfront about the potential consequences.
I agree. Got to be honest. But it's not just about scaring them. It's about giving them the information they need to take charge of their eye health.
Empowering them, you mean?
Exactly. It's like, look, you've got this risk factor, but here's what we can do about it together. Let's be proactive.
Love that approach. Yeah. Now, you mentioned treatments earlier. Are there any specific treatments for glaucoma that might work better for people with myopia?
It's tough to say for sure because every patient is different, every case is different. But there's some research out there suggesting that prostaglandin analogs, those might be particularly helpful for myopic patients.
Really? Why is that?
It seems like they're better at lowering eye pressure in those longer eyes, which is what we see with myopia.
Ah, that makes sense. So that's something to keep in mind when we're choosing a treatment plan.
Yeah, definitely something to consider. But again, got to individualize, always got to individualize.
Now, this study focused on open-angle glaucoma, the most common type. But what about other types of glaucoma? Does myopia increase their risk too?
That's a good question. We don't know for sure. There are some hints that it might increase the risk of other types, like angle closure glaucoma.
Oh, right.
But we definitely need more research to say anything definitively.
Always more research. The story of our lives.
Right. It seems like the more we learn, the more we realize we don't know.
True that. This meta-analysis, it really did give us a lot of valuable information about the link between myopia and glaucoma.
Solid evidence.
Yeah, but it also just raised a ton of new questions for me. Like, wow, there's so much more to learn about this.
It really does make you think differently about myopia. It's not just about correcting vision anymore. It's about protecting their overall eye health.
It's like we need to approach it from a whole new angle.
Oh, I like that. A new angle.
Couldn't resist.
Huh.
But really, it's true. This deep dive has been so eye-opening, pun intended this time.
Oh, you got me again.
I think this information has the potential to really change the way we manage myopia. It's not just a refractive error, it's a serious risk factor.
Absolutely. We can't ignore it.
So, with that in mind, let's move on to the final part of our deep dive. We'll sum up the key takeaways from this research and talk about how we can all put this knowledge into practice starting today.
Sounds good. Let's do it.
Okay, so much good stuff in this study, so many things to think about. Let's try to distill it all down, make sure everyone walks away with the key points. What are the big takeaways here for eye care professionals?
I think the biggest one, honestly, is just how much myopia increases the risk of open-angle glaucoma.
And not just a little bit either.
No, not at all, especially for those with high myopia. Worse than -6 diopters. Their risk is more than 4 times higher than someone without myopia. It's huge.
So not something we can just ignore. We really need to have this in mind with every myopic patient we see.
Absolutely. And axial length, too. That's another big takeaway. Even if someone's myopia isn't super high, if they have a long axial length, their risk is still elevated.
It's like a 1-2 punch. Got to think about both diopters and axial length.
Exactly. And this knowledge, it should really impact how we approach these patients, how we screen them, how often we monitor them, how we educate them about their risk.
Yeah, we talked about those comprehensive eye exams, including dilation, being essential for all myopic patients. But for those with moderate to high myopia, those with longer axial lengths, maybe we need to step it up a notch.
I think so, yeah. Maybe see them more often, start visual fields earlier, maybe even consider some of those more advanced imaging techniques like OCT,
Yeah.
anything to get a really good look at that optic nerve and see how it's doing.
It's all about being proactive, really.
Yeah.
Identifying those who are at higher risk and taking steps to protect their vision.
Absolutely. And that includes having honest conversations with our patients, explaining the risk, why it matters, and what they can do to help protect themselves.
No more sugarcoating.
Right. Got to be straight with them. But like we said before, it's not about scaring them. It's about giving them the knowledge and tools they need to make informed decisions about their eye health.
It's a partnership, really. We're in this together.
Exactly.
Well, this has been a fantastic discussion. Really eye-opening, pun intended. I feel like we've learned so much, not just about the research itself, but about what it means for our patients and our practice.
I agree. And I think it's safe to say this is just the tip of the iceberg. There's so much more to learn about myopia and glaucoma, how they're connected, how they influence each other. But this study, it's a great starting point. It gives us a solid foundation to build on.
It's a reminder that we can never stop learning. There are always new discoveries being made, new questions to ask, and that's what makes this field so exciting.
Couldn't have said it better myself.
So to everyone listening out there, keep those brains engaged, keep those eyes peeled for new research, and keep asking questions. Because the more we learn, the better equipped we are to help our patients. And that's what it's all about, right? Protecting their vision, preserving their eye health, giving them the best possible chance at a lifetime of clear sight.
Well said. That's a perfect way to wrap things up.
Thanks for joining us for this deep dive. We'll catch you next time.